Now, talking about the imaging of the vertebral column, it is very common that in our clinical practice we come across patients who have undergone a trauma, and the spine is one of the uh, areas or the parts of the body which is suspected to have undergone an injury, and that is also important to consider spine because of its lodging of the spinal cord, which can actually be involved and can lead to spinal cord injury, which is a very important clinical uh, significant condition. And for that, we need to talk about the radiographs and imaging in trauma. And that is what this part of the lecture is all about. And this, we're going to talk about the radiographs in trauma and the things to look for, such as vertebral alignment, bony integrity, disc spaces, prevertebral swelling, and stability. So, as already mentioned in the context, so the radiographic features in trauma of cervical spine specifically, but the same goes for the thoracic and lumbar spine as well. So, we have the vertebral alignment, the bony integrity, the disc spaces, and prevertebral swelling. And we're also going to talk about stability and instability. It's not just about the cervical spine, we're just taking cervical spine as a context or the frame of reference here, but the same goes for thoracic and lumbar as well. We're specifically talking about cervical spine or discussing it because of the fact that it is mostly most mobile, yet most unstable as well, and most prone towards injury. So for that makes it clinically more significant and relevant, and for that reason we are taking that as a frame of reference. Otherwise it also is applicable on the thoracic and lumbar. So vertebral alignment, bone integrity, disc spaces, and prevertebral swelling. So talking about the vertebral alignment, so disruption of anterior and posterior vertebral body lines, and which are actually the lines joining anterior and posterior margins of vertebral bodies on a lateral view or a lateral X-ray view. For example, this here is a lateral view or X-ray. So if we take at the anterior aspect or the anterior border of the vertebral bodies and the posterior border of the vertebral bodies, and we join them, we actually get the anterior vertebral line and the posterior vertebral line, as you can see here in this picture. Now, disruption of the posterior line, for example, the line joining anterior aspect of the spinous process of C1, C2, and C3. So this is the spinous process, and the line joining the anterior aspect of the spinous process, which is known as the spinolaminar line, can actually indicate an upper cervical spine fracture, most commonly the involvement of C2, if there is a disruption in the spinolaminar line. There's another important line, which is the posterior spinous line, which is actually formed by the joining of the posterior tips of the spinous process. So if we take a look at the next picture here, we can see all of these lines in a lateral radiograph as well. So this red one here is an anterior vertebral line. This brown one is a posterior vertebral line. This green one is the spinolaminar line, and this blue one is the posterior spinous line. And these are actually lines which actually help you in identifying the alignment of the structures in the spine, whether it is the cervical spine or the lumbar spine or whatsoever. And we should all, talking about the vertebral alignment, we should also take a look at the alignment of the facet joints at all levels, and abrupt disruption at one level may indicate locked facets and thus hypermobility at that segment. And as we can see here, this is the facet joint here, and these are making up an articular pillar. So if we observe a disruption in this, so it means that there is a problem, including the locking of the facet joints. And if there's a widening of space between the spinous process on lateral film, or we should look for that as well. And we should also look for the rotation of spinous process on AP film, as we already discussed in a previous section, because we can see if they're in the line, which means they are normally oriented and aligned. If we are not in a line, which means either one of these segments is rotated towards right or left. If we see that the vertebral spinous process in an AP view is slightly right, so it means the vertebral body is rotated towards the left, because if the vertebral body drifts to the left, the spinous process moves towards the right. If the body moves towards the right, the spinous process moves towards the left. So that is something that we need to keep in mind. Moreover, there is a widening of pre-dental space. Then it is actually there is a problem in the vertebral alignment if it is greater than 5 millimeter in children or greater than 3 millimeter in adults. Now, more importantly, we also look for bone integrity as well, to look for any fractures. Those fractures can be in any region. They can be anteriorly in the vertebral bodies, such as vertebral body fractures or compression fractures. And these compression fractures are very common in the elderly, in the lumbar spine as well, because that is a major weight-bearing structure. Moreover, fractures of the posterior elements such as pedicles, laminae, and spinous process. So we can look posteriorly for those type of disruptions as well. And integrity of odontoid bag, and for that open mouth AP view is very important, and we can look for that, and specifically in terms of anterior, posterior, or lateral displacement if we are suspecting an disruption in the integrity of the dents or the odontoid process. Moreover, disc spaces, it's also important to analyze the disc spaces. For example, if we take a look here, the disc spaces are wider here, but as we move down, there is narrowing of the disc spaces. For example, here we have a narrowing of the disc space, and here we have the widening. So we also should look for an alignment and symmetry of the disc spaces in terms of radiograph, and that also becomes very important in the lumbar spine, because discogenic problems or disc slips or dehydrated discs are very common in the lumbar spine, and we should look for that as well. Moreover, prevertebral swelling, specifically when talking about the cervical spine, so there is widening of the retrotracheal space. So retrotracheal space is actually the space behind the trachea and in front of the C6 vertebra. So this is the retrotracheal space. So C1, C2, C3, C4, C5, and C6. So this space here, now this is the trachea, and here we have the retrotracheal space. So prevertebral swelling is when there is greater than 14 millimeter in the children, and if it is greater than 22 millimeter in adults, then it means that there is prevertebral swelling at the level of the retrotracheal space. The prevertebral swelling can also be present at the retropharyngeal space, and the widening of the retropharyngeal space is diagnosed or is said to be so if there is a greater than 7 millimeter in adults and children. What is retropharyngeal space? It is the space between the C2 vertebra and the pharynx. So here we have the pharynx, here we have the C2, which is the C1 and C2, and we have this retropharyngeal space. We also have a space which is known as a nasopharyngeal space, which is superior to the retropharyngeal space. So looking at the retrotracheal space and retropharyngeal space, we can actually look for the prevertebral swelling. Now, talking about stability, whether injury is stable or not, instability implies the possibility of increased spinal deformity or neurological damage occurring with mobilization or movement or continued stress. For example, if, for example, you may observe that the person may not have any for example, compression of the spinal nerve root at a normal radiograph, but if we perform flexion or extension, then the closing of the facet joints and decrease in the intervertebral foramina may actually increase the compression on the spinal nerve root because of an instability, and that may be visible in one or two segments because of those unstable segments, and the other segments may be normal. So that is something that we should also look for, and that can actually be acquired. This information can be acquired via the functional views, as we already discussed in a previous part of the lecture. Now, moreover, talking about stability, if we talk about stability, there are actually three columns, the anterior, middle, and posterior column, that we can actually observe in terms of the lateral view X-ray or a radiograph. So anterior column is the anterior 2/3 of the vertebral body, which is this part. The posterior 1/3 of the vertebral body and the posterior longitudinal ligament actually is the middle column, and the posterior column has two parts, the facet joints and the bony arc of the spinous process, spinal canal, and which is the pedicles, lamina, and spinous processes. So Facet joints and bony arch of the spinal canal, which is the pedicles, lamina, and spinous process. So this part here actually is the posterior column. If there is actually disruption in more than one, which means at least two of these columns have a notifiable disruption, then it means that the stability has been compromised. Now, what are the radiographic signs of instability? They include, for example, displacement of a vertebral body, such as in a spondylolisthesis, which can be anterior or a retrolisthesis. As we can see here, this one is L4, L5, and S1. And here we can see the displacement of these segments, which are actually not aligned, and that actually is identifying instability, which is also accompanied with a fracture in the region of the pars interarticularis, and teardrop fractures of the vertebral body, such as compression fractures, and odontoid back fracture, which can be observed on open mouth AP view in the cervical spine, and widening or disruption of the alignment of facet joints, including locked facets, and that can be observed very well in oblique view x-ray of the cervical spine, for example, if you're talking about the cervical spine, and widening of space between the spinous processes, and fractures at multiple levels. So these are actually different type of radiographic signs of instability, which we should be looking for in a radiograph or an imaging scan. And that was all about this part of the lecture. I hope you learned something new out of it. Keep on watching sqadia.com for more lectures like this. Thank you very much.